All right, I think we should get started. Hi, my name is Dr. Paul Despres, if we haven't met yet. I am a physician at Aspen Integrative Medical Center in Flagstaff, Arizona. I'm also a co-owner of the business, along with Dr. Amber Belp and Cody Bethay. Today's talk is going to be about metal detox mastery. So here we're going to discuss the threat of heavy metals in our body. We're not really going to get into the whole global threat of heavy metals, but we're going to talk more on individual and health implications of heavy metals, along with the use of IV chelation and what that looks like. In addition, I'm going to go over my own heavy metal testing to give you a sense of what the heavy metal urine testing looks like. And feel free to ask any questions during the presentation. And then at the end, I will offer a Q&A if anybody has any follow-up questions. I may not see your questions till the end, but feel free to ask them as we go. All right, here we go. So just a quick disclaimer. You should always seek medical guidance and supervision with any medical intervention. So everything we're going to talk about today, you really should discuss with your healthcare provider, whether with a naturopathic physician like myself or somebody else at our clinic, or if you're seeing somebody else. Chelation therapy, it can be somewhat dangerous depending on the individual. And I do not want any harm to happen to anyone. So today's goal is mostly informational to hopefully educate you on and determine if chelation therapy is an option for you, if you should be concerned about heavy metals, and if you want to do any heavy metal testing. So a little brief bio about myself. So I am a naturopathic medical doctor. I went to Bastyr University. Some of the things I specialize in include environmental medicine, gastrointestinal health, chronic fatigue, thyroid disorders, autoimmune disease, infectious diseases such as Lyme disease, also mold toxicity, chronic pain, cognitive decline. I've been starting to get more into Parkinson's disease, men's health, and long COVID. Some of the therapies I really like to use include deep tissue laser therapy, IV therapy, clinical nutrition, detox therapies, ozone therapy, hyperbaric oxygen therapy, infrared sauna, which we have one of those at our clinic, and also botanical medicine. But I truly believe that the body has an innate healing capability, and I've seen it time and time again. If you give the body the right ingredients, also, if you remove the right things from the body, you can see some very profound healing responses. On the right is a picture of myself and my wife, Dr. Mealy, who's also part of our practice. Perhaps you met her at this point too. I'm not really going to get a whole lot into our clinic, but here's a list of some of the services that we do offer. Little picture of our infrared sauna and our IV therapy suite. But we like to be a full service medical clinic, serving your medical needs A to Z, head to toe. We have a lot of great stuff to offer. All right, so the webinar today. Here is a brief overview of what we'll be discussing. What are heavy metals? Where are we exposed to these metals? Some common symptoms and health risks of the metals. How do we assess for our heavy metal burden, which is kind of our total body burden of heavy metals. We'll take a look at my own lab results and what I learned from those. We will discuss chelation IV therapy. How does it work? Who could benefit? And who should really give a second thought whether they want to do chelation therapy or not. And finally, we'll end with a Q&A. Hopefully I can do all of that in about 30 minutes. So here are a list of the most common heavy metals. So we have aluminum, antimony, arsenic, barium, beryllium, cadmium, and some of the other ones I highlighted included gadolinium, lead, and mercury. The ones I highlighted in red, those ones are really the most alarming to me, and oftentimes the ones I find the most elevated in my patients. The one that usually shows up the highest is lead, and I'll get to later as to why. But I also see gadolinium a lot as a contrast dye to a lot of MRIs. Arsenic is very common in a lot of our soils, getting into our grains. Aluminum cooking products. Aluminum is very highly correlated with a lot of neurodegenerative conditions such as Alzheimer's and Parkinson's. And then also mercury, because a lot of mercury fillings that people have. Also mercury in all of our fish. So what are the health effects in our body and why do they accumulate in our body? So the main thing to know is that these heavy metals, the body is actually quite smart. Well, it will hide these heavy metals so they're not disrupting some of the major vital organs of the body. And the major vital organs of the body actually are like the lungs and the digestive system. They do get affected by heavy metals, but the body will hide them and kind of centrifuge them out into areas of fat. So the main areas of fat are, well, your brain, hence why you have a lot of neurological issues related to heavy metals. The fat lining your myelin, which your nerves are lined in fat. So there's a lot of neurological neuropathy issues and pain issues. But then also bone. So I don't know if you've ever eaten bone marrow, but if you break that open, it's actually quite fat, quite fatty is a better word to say. So a lot of times when people have a lot of bone turnover with osteoporosis, they can actually be leaching out a lot of heavy metals, and you can kind of see some skewed results based on that condition. So just think fat. So oftentimes heavy metals go to fat. But they're also endocrine disruptors in the body. So they frequently disrupt the adrenal gland function, the thyroid gland function, and also your sex hormones. So with each of those categories of hormones, they can also influence different symptoms on each of those glands as well. Here are some of the main sources of heavy metals in the body. Just moving my cursor. So some of the main sources of heavy metals primarily are coming into the body, either absorbed through the skin, either we breathe them in or we ingest them in our food and water. So some of the main sources to think about are fruits, vegetables, and grains are grown in water and soil that's contaminated. So they absorb the metals they're exposed to. So for example, rice has quite a high level of arsenic. Um, I've actually determined there's a Lundberg organic white basmati rice seems to have lower levels of arsenic compared to other levels. But I do suggest that patients kind of limit their rice intake to 2 to 3 servings a week, and that includes like rice cakes and other rice products. We also get exposed to these heavy metals through personal care products, beauty products such as creams and perfumes. You know, those are going to be absorbed through our skin. Also, if it's a aerosolized type of body product, that can get in through the lungs. Also, home building materials, so our piping for water, paint, and other construction materials. A lot of commercial industrial pollution goes up in the air, comes down to the water, gets into the water table, gets into our food, and gets into our bodies that way. Same issue with the mercury in our fish. So a lot of our seafood is contaminated with heavy metals, and those fish, big fish eat smaller fish and get like this larger bioaccumulation process happening where eventually when you eat something like tuna, it has a lot of mercury in it. So you really need to be careful with your tuna intake. Contaminated water, lead pipes, batteries, paint, gasoline gets into the water table. Certain medical interventions, which were not talked about enough, I think, include certain metal implants, whether it's like a joint implant, like a knee, or excuse me, a hip replacement made of cobalt. You can get poisoning from that. Our mercury amalgam fillings in our mouth, and then also our imaging contrast dyes. So gadolinium is frequently used for MRIs. And finally, I just want to highlight tobacco smoking. You know, exposes you to a variety of metals as well, cadmium, arsenic, and lead. So why might you have a high level of metals? So these are just a few things I came up with as I was thinking. So you might actually have high level metals if you eat a lot of foods that contain metals. That might seem fairly obvious, but let's say you're eating tuna on a daily basis, having a tuna sandwich. Let's say you're eating a lot of grains. Let's say you're drinking a lot of unfiltered water. Those are potential reasons why you might have high level metals. Drinking water from older supply systems, if those water pipes are contaminated by lead. Um, if you work or have hobbies that expose you to metals, solvents, and chemicals. So if you're a mechanic, you work with jewelry, you are exposed to a lot of factory chemicals. You do a lot of woodworking. Yes, metals are a part of the concern, but there's also other toxins that you would also be concerned about that you are inhaling or absorbing through your skin if you're working in that type of place. Um, Handling a lot of products with a high level of metal like paint or pesticides without using personal protective equipment. So if you are a woodworker, I'd highly suggest having a very high quality filter mask if you're ever applying paints and different things like that. Also, if you live in an environment with high air or water pollution, so up here in Flagstaff, it's not as big a deal if you live down in the Phoenix in the valley, but still there is some air pollution that comes our way all the way over from San Diego. So California produces a lot of air pollution. Where do you think that goes? It goes east. It gets in the water table and comes down and affects us here. Also, being somewhat new resident to Flagstaff, I have concerns about uranium levels. So, all of those atomic bombs that they tested out in Nevada, a lot of that went downwind this way. So, sometimes I'm seeing some elevated uranium levels in some of my patients here, and that might be a big concern. And I'm definitely worried about a lot of the indigenous populations that they were exposed as they live much closer. So here are some associated symptoms and conditions with heavy metal levels. So just to remember, heavy metals can theoretically damage almost any organ system and disrupt a variety of physiological functions. Oftentimes, they themselves can either cause symptoms or they can cause other conditions that make you concerned that you might have a heavy metal load. So I'll just kind of go to the right first. So some of these conditions include autoimmune disease like hypothyroidism, but what I really get concerned about are our neurodegenerative diseases such as Alzheimer's, Parkinson's, and MS, because those are very severely affected by any toxins that get into the brain. They disrupt immune system function. They disrupt a lot of white cell microglial activity in the brain. And I know we oftentimes go after like the plaques and the different things that they find in the brain that are issue, but oftentimes the brain is reacting to something in there. There's some disturbance in the brain that's causing the brain to behave differently or the immune system to behave differently. And oftentimes heavy metals are that disruptor causing dysregulation of the immune system. Also, if you have a lot of allergies, you have like something known as mast cell activation syndrome, where you're kind of indiscriminately reacting to things in your environment. You want to think about heavy metals, definitely multiple chemical sensitivity, recurrent infections, headaches, migraines. Some of the symptoms I think about heavy metals, as long as, we rule out other potential causes. So let's say you have fatigue, we rule out hypothyroidism, we rule out other stuff. But things like very severe chronic fatigue, brain fog, difficulty remembering tasks, changes in memory, some signs that you might be accumulating or detoxing inappropriately is if you have difficulty sweating, things are not getting out of your body. And then also gastrointestinal symptoms. So we actually detox a lot through our liver and our stool. So as the liver gets overwhelmed and the gut gets overwhelmed, you can see symptoms of IBS with diarrhea, constipation. Also, if the body is struggling to get stuff out appropriately through the kidney and also the liver, you'll see a lot of skin symptoms. So a lot of rashes can also be implicated with high heavy metals levels. I just want to take a moment to be real. And what I mean by that is detoxification is important for everyone. We live in a very toxic world. So whether you have symptoms or whether you know you have been a high risk exposure in your life with your hobbies and work, it's really helpful for us to focus on detox for everybody. And that doesn't necessarily mean chelation therapy, but that means, eating a diet high in fiber. That means sweating. That means making sure you have a regular bowel movement. So I just want to take a moment that even if you don't feel like you're being influenced by heavy metals, there's things we can do on a daily basis to make sure any metals we're exposed to get out of the body. As Benjamin Franklin supposedly said, an ounce of prevention is worth a pound of cure. So if you're concerned about your heavy metal levels, one of the best ways is to test. Now, if you're concerned about acute exposure, that's where standard blood work can be somewhat helpful because that will actually acutely see those levels of lead and mercury high in your blood. And so we do that through LabCorp or SnorQuest. You can also look at secondary markers that show you might have a high toxin level. So, look at your complete blood count, look at kidney liver function, you look at your inflammatory markers, and homocysteine, some hormone markers. If you show signs of autoimmunity, those might give you a hint that heavy metals are part of your picture and contributing to your overall presentation. Now, if you really want to know about your heavy metal burden, the best way is to do a urine provoked test. And I'll kind of explain why. So I kind of described earlier that the body will deposit these heavy metals into fat. So they're not actively circulating in your body. So if you just do a urine test, that falls under the category of acute exposure. If you're exposed acutely, it'll show up in your urine. Otherwise, your body is ditching these metals in different reservoirs of your body, different waste areas of your body, that you need to provoke them out of the body so you have a better sense of what the total burden is. And the best way to do that is with an IV that has chelators in it. So those chelators will get in through your blood. They will have better access to your brain and all the other fat tissues, and they'll start pulling those metals out of those reservoirs and then chelate them out through your urine. And so you collect your urine for 24 hours, right when you start that chelation IV. And then you have a better sense of what your levels are. And basically, you come in for the IV, we give you the kit, you ship your urine yourself, or you bring it back to our office and we would ship that out for you. Oftentimes, I do a pre-chelation collection as well, just to see if you've had any acute exposure to heavy metals. The best lab that I trust is doctor's data, and that's the urine test. So let's look at my test results. So I did this, I don't know, a year or two ago, and let's see what we can learn from it. So we can see on the right side, you can see all the different levels. Several of them are kind of in the middle, moderate to high range. Luckily, nothing is in the red. If I see things in the red, then I'm really concerned about whoever I tested. The chelator that we typically use is EDTA. Now, EDTA has the biggest affinity to bind to lead. So oftentimes you'll see lead being really high and all the other ones being kind of either moderate to low. So as you chelate, your lead levels will go down and you'll actually see some of the other ones start to go up because now there's less lead in the body. The binders can bind to other metals. So when I saw my tests, I was moderately concerned about my lead and mercury levels being here in the yellow. Now, I do have some symptoms of autoimmunity, chronic pain that would make me think getting these metals out of the body would make me feel better. So I have done some chelation therapy. I also have done a lot of MRIs in my life, do a lot of chronic musculoskeletal issues, and you can see my gadolinium is definitely higher than normal. So that most likely is due to a lot of those contrast dyes that I've done. I'm not quite sure where the thallium came from, but I'm definitely most interested in the lead and mercury and gadolinium. Normally, I don't see mercury toe to toe with lead. So I do know I ate a lot of tuna as a kid, and I've also been eating a lot of sushi. Most likely, that mercury levels come from the seafood that I've done. I will get to that question soon. Let's keep going. Thanks for the questions. Keep posting questions. I'd be happy to answer all of them at the end. I hope my video doesn't block too much here. I'm kind of moving it around. All right, so next slide. So in my opinion, the best treatment for heavy metals is chelation IVs. But it's not for everyone, and I will get to that. But the reason I think they are the most helpful is because it can access all your body tissues more easily. It has a better affinity to pull these out. Because a lot of times folks have compromised gastrointestinal issues where if you do oral chelators, they're not going to necessarily be absorbed as well in your intestines to get to all the areas of the body to pull those metals out. So what's nice about the IV chelation, it has direct access to a lot of these fatty tissues, your muscles, and even cross the blood-brain barrier. So folks who have a lot of cognitive issues, neurodegenerative issues, um, IV chelation is usually the best. It's also better because you can reach faster results. Along with that, they are more aggressive. So there's a chance for more side effects. And that's where it really gets into you working in concert with your healthcare provider to make sure it would be safe for you. Also to do pre, during, and post therapies to lessen any side effects. So chelation, in my mind, is a helpful treatment, but has to go hand in hand with a lot of other therapies to make sure you get the most out of it, and then two, it doesn't cause harm. Oftentimes, I will follow chelation IV with a glutathione push for added detox support, and sometimes every other chelation therapy, I will follow up with a nutrient support to make sure you're remineralizing, magnesium, calcium, potassium, all of those things, B vitamins, vitamin C. Make sure your body is supported and not being depleted too much. On the right side, I just kind of listed the IV ingredients, typically in an IV bag, and the IV takes about 90 to 120 minutes. And not with everyone, but if you want to be more thorough, we follow with another chelator called DMPS. So let's just pause for a second. And I think this might fit into the question that's already been posted, but we need to think twice before chelating, especially if you have mercury fillings. So if you start doing IV chelation, it will cause some of the mercury to leach out of your fillings that will circulate in your body. Any chelating we do, we want to make sure there's no redistribution, meaning we start moving things and it doesn't get out of the body and it just lodges in another place and causes more issues. So we want to make sure your organs of elimination are working well. So we want to make sure you're not constipated. We want to make sure you can sweat. If you have severe multiple chemical sensitivity or mast cell issues, it can flare those conditions. So you need to titrate the right dose. Maybe oral chelation is better for you, or maybe some other more gentle binders would be better for you. Chronic kidney disease. So a lot of these chelators and the toxins, the metals, get out through the kidneys. So if you already have impaired kidney function, like low kidney filtration rate, we need to be really careful. But on the flip side, chronic kidney disease, some of it is associated with heavy metals. So removing those metals will create less stress on your kidneys, but you got to titrate it in the right way that it doesn't cause harm. So oftentimes I like to support my patients before, during, and after chelation. That might be some oral chelators you do at home. That might be some oral glutathione, making sure you have the right nutrients circulating in your body to prevent redistribution and redepositing of these metals. So that makes sense. You need to work in hand with your provider. I would not recommend anybody just do willy-nilly IV chelation or oral chelation in that matter. So we're running a few chelation IV specials for the rest of January. So our chelation IVs are 10% off. If you aren't an established patient, I do want to have a brief consult with you to make sure it's safe. Make sure this is indicated for you, and make sure, we might need to want to do some testing beforehand. Usually I'm not doing a lot of chelation therapies unless I know, one, you have a high load, so whether acutely or chronically. So sometimes it's best for us to do that urine test to make sure it's indicated for you. Also, if you buy a chelation IV, we'll give you a free sauna treatment in our infrared sauna, so you can try that out. Also, we have a weight loss program, so if you sign up for that, we're still giving a 10 free sauna package with that as well. So our detox webinar series continues next week with Dr. Jamie Flannery. So she's going to discuss estrogen, the estrogen equation, your blueprint to balance and detox. So she's going to get into the whole estrogen progesterone balance, what that means for your body. And it kind of goes hand in hand with a lot of detoxification too. So certain heavy metals can disrupt your estrogen and progesterone levels. But she's going to do a deep dive into estrogen dominance, some of the symptoms, factors contribute to that, go over some labs and specific hormone patterns related to estrogen dominance, which is very common these days due to a variety of reasons, and I'm sure she'll get into that. All right, so perhaps sometimes my favorite part is getting into the Q&A. So Renee was curious, hopefully I pronounced that right. Renee was curious. I understand IV chelation EDTA can be dangerous because of how much it stirs up and redistributes. I would agree. I tried a few sessions with Dr. Bell years ago, and we decided my body didn't tolerate the IV chelation. I've since discovered the slow study method of Andy Cutler. I'm not familiar with Andy Cutler. I'd have to do some research with Andy, but you bring up a good point of kind of what I was discussing earlier. IV chelation is not for everyone. Um, Perhaps due to your history or your toxin load, IV chelation might move things too fast. You might need to have more of a glutathione IV beforehand. You might need a nutrient IV right afterwards. Maybe oral chelation is better for you. And then you also bring up curious about MTHFR. So there are genetic mutations that mean or indicate that you might detox ineffectively. So for those folks, they might need an additional support, whether that's certain B vitamins, certain nutrients, other oral binders. Maybe your IV dose needed to be much less. Maybe you would do better with just some gentle binders like activated charcoal or bentonite clay. Maybe focusing more on sauna. So maybe you weren't sweating. So there's a lot of these factors that need to be considered. And oftentimes, if somebody does one IV and they don't tolerate it very well, I wouldn't necessarily recommend they do another one right away. We need to look at the underlying reasons why you might not have tolerated that well and determine if we want to do another one with you, or if we wanted to reduce the dose or focus on other type of chelation or detox therapies. But it needs to be done in the right way. All right, so I guess with that, since there's no more questions, I'll just end it for the night. I will definitely look into Andy Cutler for you, Renee, and see if perhaps his methods or protocols are similar to other things I've done with other people. Because I mean, IV chelation is one of the many ways I approach detox. It's not something I do with everyone, but I find it as a very helpful tool for the right people. But if you guys have any further questions, feel free to give our office a call. Tell Jane what your question is, and she'll share that with me, and I will get back to you as soon as I can. But otherwise, thank you for your attention, and thanks for attending, and I hope you all are happy and healthy and well tonight.